unethical, disgusting. You're a virus.
There's no pandemic. Media is the cancer.
People are going to die. They die no matter what.
I need a haircut. Yes. That's great.
For heaven's sake, open the barber shops. Open the hair salons. We need haircuts, okay? We gotta buy food. We gotta go to work. We gotta provide for our families.
When it comes to the pandemic, are you scared at all? Do you believe in it?
Yes,
I believe it's
sure
real.
do. Exactly, It is real.
We still have a right, I think, to
work. And we have a higher power that we believe in that takes care of us. And I know that it's a real thing. The pandemic is a real thing. We do believe in that. But we want to work. We want to work. We don't want a government handout.
Almost none of the street protesters Thursday wore masks or physically distanced, as the CDC recommends.
No, we aren't. We're not scared of this virus.
God bless America.
Where's the circus? It's in that building right now where they're pretending that we need a social distance. Where they're pretending we need masks. They should wear the mask.
Are innocent until proven guilty, which means we do not need an immunity certificate, we do not need a test to prove that we're not vectors of disease and out walking around.
We want to open it up so we can make our own health. He don't need to be our deciding factor when we go to the doctor. We can't even get to the doctor right now because he got it all clouded up with corona. It's not all about corona, it's about cancer. It's about all these other diseases and all these other illnesses. People being put on hold for surgeries and stuff because you need to open it back up and let us be our own choice, our own voice.
Can I see the back of your vest? This is Bikers for 45. He's the president of the Minnesota chapter.
If you can't make the choices for yourself, you no longer live in a free country. And right now, we do not live in a free country. We have to wait for permission from the government at many levels to be able to do something. Go out of the house, go shopping, gather in groups of 10 or more.
Men and women are tyrants! My husband and my son were confronted by the police last week for simply trying to make a living, all the while these politicians are being paid from our tax dollars! They are suffering! We are suffering! This is an uprising!
We have real-world examples. We had a church gathering here in Kansas that had 50 people infected, 6 deaths, and they went to 9 counties so far, and with the illness, and have been. That's how the spread occurred.
Have you considered the health ramifications of being in a large group of people?
Yes.
And that doesn't change your mind?
No.
Why do you think the doctors are saying that?
They don't have any choice. Of course they have to say that.
USA! USA! USA!
Unethical, disgusting. You're a virus.
We're trying to do the right thing and we don't need to get attacked. It's not fair to get attacked.
And a handful of nurses wearing masks, refusing to move.
Pictures of nurses and physicians with bruises on their faces and crying because they can't take another day of losing patients. It's just incredible that that doesn't seem to affect people.
And you say I don't have the right to stand here and debate you? Listen, honey, we can have a decent conversation. You can't outline
It really feels like a slap in the face to medical workers. I get it. I don't want to be stuck in my house either. I don't think many people at all are enjoying this. That's not the point.
People die from all kinds of things every day. That's just the way of life. The people that are getting sick are the people that are already compromised in the first place. They're usually older, they're unhealthy. I'm sorry for them.
Unless we get the virus under control, the real recovery economically is not going to happen. So what you do if you jump the gun and go into a situation where you have a big spike, you're going to set yourself back. So as painful as it is to go by the careful guidelines of gradually phasing into a reopening, it's going to backfire. That's the problem.
Start trouble and everybody's going to end up going to jail. They won't just take you to jail and her to jail, they'll take everybody to jail and it'll be on your record for the rest of your life. Is it worth it?
We have a right to be here too.
And they're saying reopen PA with no testing. It's like they don't care about life. They don't care about the people around them, the people they love. I care about the people.
The president's policy says you can't start to reopen under his plan until you have declining numbers for 14 days, which those states and my state do not have. So then to encourage people to go protest the plan that you just made recommendations on Thursday, it just doesn't make any sense.
Much of this feels like a Donald Trump re-election rally at the same time. Many people coming out to support the president, many not wearing masks. Some are, but a lot of the people in this crowd right now are not wearing masks and don't have a particular concern about the coronavirus.
We are here exercising our God-given American rights, our Second Amendment, and we're here in support of firing DeWan, getting rid of him. He hasn't done anything for this state other than cause economic grief.
Everybody around the world is sacrificing, really taking on a lot of hardship to be able to flatten this curve and to reduce this slow spread. And it's kind of like deciding after you jump out of an airplane and you've pulled your parachute, if now that you've started to slow down, that you say, hey, I don't need this parachute anymore, and just cut the cord.
We are essential! We are essential! We are...
Keep your voice down, please. Keep your voice down.
Because information about the virus should have been told to us earlier and a lot sooner. People knew it was happening and people did not want to talk about it. Many Americans are saying the exact same thing about you, that you should have warned them the virus was spreading like wildfire through the month of February instead of holding rallies with thousands of people. Why did you wait so long to warn them?
Who are you with?
And why did you not have social distancing until March 16th?
Who are you with?
I'm Weijia Jiang with CBS News.
So, if you look at what I did in terms of cutting off or banning China from coming in,
Americans who are also
Nice and
coming
easy,
from China.
nice and easy. Just relax. We cut it off. People were amazed. These gentlemen, everybody was amazed that I did it. We had 21 people in a room. Everybody was against it but me. Dr. Fauci said, had I not done that, perhaps tens of thousands, and maybe much more than that, people would have died. I was very early, very, very early. And we just saw, you saw Brett Baer making a statement. They had a debate well into February, and not even mentioned, it wasn't even mentioned, the Democrats. We were very early. Oh, I'm the president. And you know what I just did? And you know what I just...
And by the way, when you issue the ban, the virus was already here.
Okay, and you know how many people, when I issued the ban, how many cases of virus were in the United States when I issued the ban? Do you know the number? No, how many cases? Remember I said one person. How many cases were here when I issued the ban? Tell me.
Did you know?
No, you have to do your research. How many?
I did my research. On the 23rd of March, you said you knew this was going to be a pandemic.
Can I tell you what? I did know it. I did know it. All I have to do is look.
So you knew
Anybody knew it. Just, are you ready? How many cases were in the United States when I did my ban? How many people had died in the United States?
Did you acknowledge that you didn't think
Keep your voice down,
going to
please.
spread?
Keep your voice down.
Did you not?
How
think it
many?
was going to spread?
How many cases were in the United States? I did a ban where I'm closing up the entire country. How many people died? How many people died in the United States? And yet I closed up the country, and I believe there were no deaths, 0 deaths at the time I closed up the country. Nobody was there. And you should say thank you very much for good judgment. How many people had died in the United States?
Did you acknowledge that you didn't think
Keep your voice down, please.
No,
testing and contact.
You're putting words in my mouth. I said, open up Las Vegas.
You want casinos open, Vegas back in business. Is that a responsible call to make?
Well, that's a piece of it. I want the hotel rooms open. We have 155,000 hotel rooms, and most of our people who live here and are part of the population are hooked to those hotel rooms in some way or ancillary way.
So you want
and
like hotel rooms, casinos, the theaters open? I mean, you want Vegas back in business, no?
I want our restaurants open. I want our small businesses open. I want our people back in employment.
But
and so
casinos, you want
it.
them open because obviously visitors are not going to come without casinos and shows and things.
Well, no, they'll come because they love. We've got Major League Sports here, and we've got so many ancillary. I'd love everything open because I think we've had viruses for years that have been here.
That is the call you said you weren't making. That is the call. You want casinos open, you want stadiums open, you want restaurants open, you want Vegas back in business.
And Anderson, you're being very specific, and I appreciate it because that's where you're seeing it. No, the reality is I want us open in the city of Las Vegas so our people can go back to work. We've never closed down the United States. We've never closed down Nevada. We've never closed down Las Vegas because that's our job, an entertainment capital of the world.
I get the financial losses people are suffering, which is awful, but you're encouraging, I mean, hundreds of thousands of people coming there in casinos, smoking, drinking, touching slot machines, breathing circulated air, and then returning home to states around America and countries around the world. Doesn't that sound like a virus petri dish?
No, what it sounds like, you're being an alarmist. I'm not. I've lived a long life. I grew up in the heart of Manhattan. I know what it's like to be with subways and on buses and crammed into elevators. I think you are by saying what you have just said.
So you don't believe there should be any social distancing? You don't believe that this is
Of course I believe there should be. Of course.
How do you do that in a casino?
That's up to them to figure out. I don't own a casino. I don't know anything
Wait a
about
minute, wait a minute. I'm sorry. You're the mayor of Las Vegas, and you want casinos to be open, even though you have no authority, thankfully, over casinos. But you say open them up, but you have no responsibility about how that would be done safely?
No, you're blurring. No, you're blurring.
You said it's not your job.
There. I am not a private owner of a hotel. I wish I were. And I would have the cleanest hotel with 6 feet figured out for every human being comes in there. Right now, we're in a crisis health-wise. And so for a restaurant to be open or a small boutique to be open, they better figure it out. That's their job. That's not the mayor's job.
Chinese researchers have shown how this virus spreads. And I just want to put up for our viewers. This is a restaurant.
Anderson, you are tough.
No, I'm not
We're
talking.
back to China. This isn't China. This is Las Vegas, Nevada.
Wow. Okay, that's really ignorant. But hasn't it been because of social distancing that the numbers have been what they are?
How do you know until we have a control group? We offer to be a control group. Anybody who knows anything about statistics knows that, for instance, you have a vaccine.
You're offering the citizens of Las Vegas to be a control group to see if your theory on social distancing works or doesn't work.
Wrong. Absolutely wrong. Don't put words in my mouth.
You just said we'll be a control group.
Excuse me. What I said was, I offered to be a control group, and I was told by our statistician, you can't do that because people from all parts of Southern Nevada come in to work in the city. And I said, oh, that's too bad, because I know when you have a disease, you have a placebo that gets the water and the sugar, and then you get those that actually get the shot. We would love to be that placebo side so you have something to measure against.
You want to get the placebo. You don't want to get the actual. Well, no, the group who gets the placebo, by the way, usually gets the short end of the stick. I haven't heard you say yes that you would be sitting on those casino floors every night along with the people that you say you are holding their hands with.
What is the purpose of that? First of all, I have a family.
Because it would be putting your money. It would be putting money where your mouth is, to use a Las Vegas term.
Anderson,
if you say it's safe,
Anderson.
Okay, so you're not willing to sit on the casino floors with them when they're reopened and breathe the refiltered air.
First of all, I don't gamble.
I'm not a doctor, as you possibly have found out. I'm not a doctor, but I'm a person with common sense. I'm not a doctor, but I have common sense. There are promising therapies. And that would be it's called remdesivir. I don't want to get anybody overly excited, but I'm very excited by that. So you have remdesivir, and you have chloroquine, and some people would add to it hydroxychloroquine.
That's a drug that the president has directed us to take a closer look at. We want to do that in the setting of a clinical trial, a large, pragmatic clinical trial.
And I say, try it. Take it. I really think they should take it. In fact, I might do it anyway. I may take it. I've seen things that I sort of like, so what do I know? I'm not a doctor. I'm not acting as a doctor. I'm saying, do what you want. Hydroxychloroquine and the Z-Pak, I think, is a combination, probably is looking very, very good.
I'm not totally sure what the president was referring to. If you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information.
Why should we be testing it in a test tube for 1.5 years when we have thousands of people that are very sick? The vaccine does have to be tested for a long period of time because you can't give, thousands, millions of people a vaccine and it turns out to be dangerous. It's tested in the sense that it doesn't kill you.
What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe, but I like to prove things first.
I'm not a doctor. I'm just saying we hear great results. I really think it's a great thing to try, just based on what I know. Again, I'm not a doctor. And zinc, they say zinc. You should add zinc. So you add the zinc.
Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree.
I disagree. Maybe and maybe not. Maybe there is, maybe there isn't. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it. I like this stuff. I really get it. People are surprised that I understand it. When somebody is very sick, they go to a doctor, go to a hospital, they record it, they're very sick, and then they live or they don't live. The people that are sick are going to a doctor or they're going someplace and they're going to say, make me better. Every one of these doctors said, how do you know so much about this? When you look at these hospitals, the amount that they order, you almost say, how could they possibly use so much, whether it's masks or the protective gear? Why aren't they able to use that mask a second, third, fourth time? If you take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona?
No. Probably not.
There's a study out there that says people that have lupus haven't been catching this virus. No, maybe it's true, maybe it's not. Young people seem to be, you can't say immune to it, but they're certainly, the numbers are very small. We're ordering a lot of supplies. We're ordering a lot of different elements of medical. I think they're going to start the process of giving the drug through mouth. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows. Don't forget the doctors. If it were up to the doctors, they may say, let's keep it shut down. Let's shut down the entire world.
Dr. Fauci. Our next expert is Dr. Anthony Fauci.
Tony knows what to do.
Dr. Anthony S. Fauci.
Tony and I.
We turn now to Dr. Anthony Fauci.
Dr. Anthony Fauci.
Dr. Anthony Fauci.
Thank you so much, Dr. Fauci.
My name is Dr. Tony Fauci. I'm the director of the National Institute of Allergy and Infectious Diseases at NIH.
Even as a boy, Tony was distinguished by his courage. In a neighborhood full of Brooklyn Dodgers fans, he rooted for the Yankees.
So I was in an Italian and American section called Bensonhurst, and it was a very family-oriented, very warm, nurturing. My father is first generation. His father was born in Italy, came to the United States at the turn of the 19th to 20th century. They called him Doc. Back then, pharmacists were called Doc because many people who either couldn't afford to go to a doctor or didn't want to take the time of making an appointment would go in to their neighborhood pharmacy.
And he still quotes what he learned from Jesuit teaching: precision of thought, economy of expression. And now you know why he never ran for public office.
He was a great basketball player. Did anybody know that? He was a little on the short side for the NBA, but he was talented.
And graduated first in his class in 1966 at Cornell Medical College.
Noted public health scholars were opining and even testifying before the United States Congress that with the advent of antibiotics and vaccines and public health measures, quote, the war against infectious diseases had been won. At that time, I was on my way to begin, of all things, a fellowship in infectious diseases at the National Institutes of Health. I sort of felt like I was going to Miami to be a ski instructor.
Before this malady even had a name, it had a fierce opponent in Dr. Anthony Fauci.
This is a new disease, at least in the United States.
It just struck me as an oddity that otherwise healthy men and another oddity, otherwise healthy gay men, got an infection that you virtually never see in someone with a normal immune system. And at that point, it was like, oh my God, we're dealing with something new. decided I was going to stop what I had been doing and devote myself completely to studying what I felt would be an enormously difficult disease. And it unfortunately turned out that that was the case.
And that's an issue that I really must emphasize over and over again, that there is no scientific evidence at all that it can be transmitted by casual contact.
One of the toughest decisions, I had a few, was when I made a decision during the middle of the early years of the AIDS pandemic to bring the activist community into our deliberations, because most of the scientific community, including my own staff, were totally against that.
But I think you have to...
If you start that business about science isn't done that way, I'm going to come down there and slap your face.
All right, Larry, hang on for a second.
Remarkably, he has gone from being burned in effigy by AIDS activists in the early days of the epidemic to winning their trust and respect.
You know, I want to say something about Tony Fauci, because I think the world must think I hate him or something, the way I'm going on tonight. I love Tony. Actually, I think I probably have a more complicated relationship with Tony than anybody in my entire life. He is a man, an ordinary man, who is being asked to play God. And he is being punished because he cannot be God. And that is a terrible situation to be in, to be the lightning rod for all of us. But he is there, and he has been this incredible fighter for us and for AIDS.
I love you, Larry.
How many presidents have you known personally?
Essentially all of them to a different degree. I knew President George H.W. Bush very well.
Who are the ones that you would point out to young Americans as figures who should inspire this country?
I think of Dr. Fauci. Probably never heard of him. Well, you did. Ann heard of him. He's a very fine research top doctor at National Institute of Health, working hard doing something about research on this disease of AIDS.
I didn't see the debate. I was out of town coming in on a plane, and the next morning when I walked into the NIH, as I walked into the lobby, people started going like this, and I said, what is this all about? I said, what do you mean what's this all about? The president called you a hero during a national debate that was seen by 100 million people, and I was totally surprised.
For his determined and aggressive efforts to help others live longer and healthier lives, I'm proud to award the Presidential Medal of Freedom to Dr. Anthony S. Fauci.
Got to be quite close with President George W. Bush. He took a very keen interest in global HIV/AIDS and allowed me to be one of the architects of the program, which has now transformed HIV globally, the President's Emergency Plan for AIDS Relief, or PEPFAR. But we can end it as a global pandemic. It's within our grasp. It was started and sustained by the phenomenal work of our president, and we just need as a society to just take it over the goal line. And I think we can do it. I really do, Barbara. I believe we can.
Under 6 administrations, who has been the coolest president that you have worked with?
Well, there's not a chance in the world I'm going to answer that one. Leadership takes many forms, including the quiet leadership of example.
I said earlier today that I hope we can do this by Easter.
You don't make the timeline. The virus makes the timeline.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
Now, you're 74.
Right.
How long are you going to work?
I'm just going to keep doing it until I'm not effective. And right now I'm as energetic and I believe as effective as I've ever been.
Fauci.
So for those of us who served in the Obama administration and worked on the Ebola response, it was a really enlightening and jarring and frightening experience because I think it helped us to understand just how vulnerable the world remained to a disease that could be a lot scarier than Ebola. Ebola was a very scary disease if you caught it, but the chances of catching it, the chances of it spreading on a global level were very small. So I think a lot of us came away from that thinking, my goodness, we are nowhere near where we need to be for something that would be much more transmissible. And so there was a lot of energy in the last few years of the Obama administration to try and put in place what we could to leave the government in a better place. One was to set up a team at the White House that was solely dedicated to health security preparedness and response. The idea there was having a cell of people at the White House who could pull together all of the different parts of the federal government that had a role in this. And, you think of all those parts. It's Homeland Security for the immigration and border stuff. It's the FAA for the airlines and the air travel. It's, of course, CDC and Health and Human Services. It's USAID for the overseas part. It's a very complex operation, and you need that core of expertise at the White House that know where those capabilities sit and the government knows how to make them work together. Then that new team at the White House pulled together what we call the Playbook. That was a document that laid out the different stages of readiness that the federal government would need to go through. Okay, here are the indicators that suggest that you're in the lowest phase of activation. And if you see these indicators, you need to move up to this phase of activation. And here are the key questions you need to ask. Here are the different parts of the government you need to be talking to. One of the things that was identified as an early priority was testing. PPE availability, personal protective equipment, was another priority focus within that document because we knew that was an area of potential weakness. And so that would have to be an early focus if we saw a novel virus overseas. And it was very explicit in the document that something like COVID should set off alarm bells. The document specifically talked about a novel virus, meaning a virus we hadn't seen before, for which we had no medical countermeasures, and which was showing the ability to efficiently spread from human to human. It was very explicit in the document that that sort of scenario needed to trigger great concern and a lot of active preparation. And I think what we saw instead, partly because they ignored that playbook, was that scenario emerged overseas, and the main response of the Trump administration initially was just to shut down travel from China and to basically assure the American public that the risk was low, but not to trigger the sort of domestic readiness measures that were very explicitly laid out in that document. So initially, when the Trump administration came in, they retained the pandemic preparedness team at the White House. But when John Bolton arrived as the national security advisor, he got rid of that team. The playbook that we left behind clearly was not used, because if they had asked themselves some of those very basic questions at the beginning of this, I think they'd have been in a very different place than they now are. Biologists and virologists and pandemic planners have been pointing out for years that it was basically inevitable that we would see another novel pathogen at some point that would combine very high transmissibility with a significant case fatality rate. To anyone who had worked pandemic preparedness before, it was very clear in late January that we were facing a huge risk in the United States. Watching what was happening in Wuhan, with hospitals being overwhelmed, with the aggressive spread of the virus, there was no reason to look at that and think that we were not equally vulnerable to that here in this country. But we were lucky. We had a head start that China didn't have. We had time to prepare. However, to trigger that preparation, the federal government needed to say very loudly and very forthrightly, but very calmly and professionally, this is a real risk. Hospitals need to be preparing. The public needs to be preparing. You need to be preparing for disruption in your lives. And That wasn't being said. That, in effect, sent a message to hospital executives and to the public and to business leaders that basically this was under control and they didn't need to make any major adjustments. And that was how it was heard. And it was just clearly the wrong message. And part of the reason now we're in such a scramble is because of that poor messaging and that poor risk assessment that we saw throughout the whole month of February from the administration. And I think what is strongly suggested by the reporting of the president's preferences on this is that he didn't want that kind of forward-leaning risk messaging. He was worried that it would spook the stock markets. It's very frustrating for those of us who have worked these issues from inside the government, who know how this works and how it should be done, to then see him try to avoid any responsibility and claim that this was totally unforeseeable, because literally everyone in the public health field has known that this was a real possibility. And anyone who's paid any attention to it, and there are a lot of us, has known how vulnerable we are. So for him to act as though it somehow absolves him that he was unaware this was a possibility, it doesn't absolve him. It just shows how ignorant he was of the risk.
We have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear.
The lack of a coordinated federal response is really damaging. And I've spent a lot of time in the last few weeks talking to local mayors' offices and governors' offices around the country, and all of them use terms like free-for-all, Wild West. We're all competing with each other. You cannot run a 50-state emergency that way. You cannot run a 50-state emergency in which all 50 states are competing for the same pool of supplies, for the same pool of expertise, where they need policy consistency in how they're applying measures, but they're basically left to their own devices to figure out what those measures should look like. The governor of Florida allowed spring break to go forward and allowed the beaches to stay open, allowed the bars to stay open. And all of those kids came down, partied on the Florida beaches for a few weeks, and then went back to places all over the country. And some of them will have brought back coronavirus with them to those communities. That is a decision by one governor in one state that poses risks to almost every state in the country. So when you don't have consistent policy coherence on how we fight this, coming from the federal level, you leave it to each governor and each locality to be making their own decisions, and they're going to make those decisions differently, and it basically becomes a lowest common denominator effort. The basic reality of why we are in the trouble we are in the United States now is that preparedness is a choice, and poor preparedness is a choice. The decision not to prepare in the face of an obvious threat is no excuse when you then find that that threat is overwhelming you later on.
Instead of asking a nasty, snarky question like that, you should ask a real question.
Mr. President, did you or your family sell stocks?
No, I don't have stock. I own things that...
Did you make any alternates to investments in advance of this?
No, I didn't even think about it. It's very interesting that you ask a question like that. Nasty question, and yet it deserves to be asked, I guess.
Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. What did he mean by our?
Oh, what are you asking?
And even the fact that taxpayers from
What's
every
that? I got
state
you.
pays
I got
for
you.
it.
You
No,
used
it's
the
not
word
a
our.
gotcha.
It's such a basic, simple question, and you try and make it sound so bad. You ought to be ashamed of yourself. You know what? You ought to be ashamed. It's such a simple question. You just ask your question in a very nasty tone.
What do you say to Americans who are upset with you over the way you downplayed this crisis over the last couple of months? We have it very much under control in this country. The coronavirus is very much under control in the USA. It's going to disappear. It's like a miracle. It will disappear. March 4th, we have a very small number of people in this country infected. March 10th, we're prepared. We're doing a great job with it. It will go away. Just stay calm. It will go away. What do you say to Americans who believe that you got this wrong?
And I do want them to stay calm. And it's people like you and CNN that say things like that, it's why people just don't want to listen to CNN anymore. You could ask a normal question.
Could you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
That question?
Yeah.
Maybe 15 times. You don't have to ask.
He's your medical expert, correct?
He's answered that question 15 times.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope
No, I
and
don't think so.
misrepresenting the preparedness right now?
No, I don't think so. I think that, I think it's got,
The not yet approved drug.
Such a lovely question.
What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. You ought to be ashamed of yourself.
My first question is, you said that you don't take responsibility, but you did disband the White House pandemic office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question.
Ventilator manufacturers are doubling, tripling, even quadrupling their production in some cases.
That's true.
And yet medical experts and some of these manufacturers are predicting that there will still be shortages of tens of thousands of ventilators. Is it time for you to level with the American public that there likely will be shortages of ventilators in some cases?
We think that, we have a good amount ready to move. I mean, literally, like an army. They're ready to move to any hotspot. But some of the ones that you're talking about, always a nasty question from CNN, but some of the ones, because I think that, frankly, because you know what, you've asked that question about 10 times over the course of about a month. Thousands of lives by
time that you bought, the argument is that you bought yourself some time, you didn't use it to prepare hospitals, you didn't use it to ramp up testing. Right now, nearly 20 million
you're so
people
disgraceful.
are unemployed.
It's so disgraceful the way you said it. Let me just, listen, I just went over it.
To make people
I just went over
in
it.
an unprecedented crisis.
Nobody thought we should do it. You know you're a fake. You know that. Your whole network, the way you cover it.
Thank you for coming back to the show. Mom told me I had to. Governor Andrew Cuomo, I appreciate you coming on the show.
Thank you.
I love you. I'm proud of what you're doing. I know you're working hard for your state, but no matter how hard you're working, there's always time to call Mom. She wants to hear from you, just so you know.
Yeah, I called Mom. Just before I came on this show. By the way, she said I was her favorite.
She never said
Good news is she said you were her second favorite son. You're better than me.
Only on the basketball court.
Never, don't lie.
That's what Pop said. That's what Pop said.
Never. He did not. He did
what
not.
He said.
You never beat me once.
The country should
not
know.
once.
He said Andrew has tremendous capability. He is blessed in many ways, but he's got hands like bananas and he can't play ball. Everybody knows it. Just saying.
Put the money
You're
on
doing
the
a great
table,
job, though.
and I'll take you out and spank you.
Last night, I was doing what I do for my family, which is make my mother's sauce. She taught me how to make this sauce, which is something that is very coveted. And she said, I can only teach he, not she, he who will carry it on best. And you will see the B-roll of me cooking. My mother called me and said, is Andrew there? I said, no, Mom, I'm all alone here out on the island with my family. And she said, where is he? And I said, he's up in Albany in the house with the big gates and the attack dog. And she said, oh, that's too bad. And I said, it's okay, Mom. I love him and I'll make sauce for him too. And she started to cry and then I said goodbye.
Yeah.
That's what happened.
You've always been good at manipulation. You've always been the meatball of the family.
Let me ask you something. With all of this adulation that you're getting for doing your job, are you thinking about running for president? Tell the audience.
No.
No, you won't answer?
No, I answered. The answer is no.
No, you're not thinking about it?
Sometimes it's one word. I said no.
Have you thought about it?
No.
Are you open to thinking about it?
No.
Might you think about it at some point?
No.
How can you know what you might think about at some point right now?
Because I know what I might think about and what I won't think about. But you're a great interviewer, by the way.
Appreciate it. Learn from the best.
he is going to be fine. He's young, in good shape, strong, not as strong as he thinks, but he will be fine. He's my best friend. My father was always working, so it was always just me and Chris. Can I ask you, where are you?
I'm in the process of making a point where I am. I'm in my basement.
But where are you physically?
I'm in my basement.
You're in your basement.
That's what I just said. Yeah, that's where I am.
Oh, you're in your basement. I see. Well, you spend a lot of time there, right? Christina says she sends you there a lot. So kitchen and basement, that's where you've spent your life. Okay.
Here's what I'm trying to say. I'm in the
question?
basement because this is where I had the availability to do this. Right now, I need to be working at home. That's why I'm here.
And look, some of us have to work, right? I don't have the luxury of working 1 hour a day. God bless you.
Well,
I'm happy
first
for
of all,
you.
it's a full-time
But most of us
job.
work more than 1 hour a day. That's all I'm saying.
You certainly have been working a lot. And I'll tell you what, be careful. Not just because you look like you've been burning a lot of hours, but you show up in a lot of places. And I know it gives comfort to people. But if you get sick, God forbid, there's only one of you right now. And if you get sick, it's a problem. So I know you like to run around with your ill-fitting jacket, but just remember that. You got to stay healthy. I need you, big brother, because I love you and you're the center of the family, but you're the center of the state right now also.
Yeah, but I have to do my job, and Mama didn't raise an armchair general in me anyway. I'm not going to sit in my basement. I say to the National Guard every time before I go out there, I'll never ask you to go anywhere that I won't go. I'll never ask you to do anything that I won't do. So I need to be out there doing my job. You stay where you are in the basement. I think it's very nice. I love you. Be safe. Call me sometime.
I have to be honest. This basement puts me in a bad position, and I am sitting in an armchair right now. Those are two terrible facts. I'll talk to you soon. I'll send you some sauce.
Love you, brother.
Mom's secret.
Love
favorite.
you. Oh, yeah, thanks. Yeah, I know. Meatball. Yeah,
I heard it. It's a term of endearment in Italian circles. To be the meatball,
Yeah,
you can please make him, please hang up on him now. Thank you very much. He has a lot of work to do. Is he gone? Is he gone? He's gone. Meatball is a term of endearment in any Italian family. They only call one son that, and it is the best thing you can be called.
Love you. I do love him.
The tension is real, though.
I can't do my job. I can't help anybody because y'all decide to block up every entrance way to get to the hospital.
Total chaos. Green light. Everybody stopped up.
It's time for our state to be opened up. We're tired of not being able to buy the things that we need, go to the hairdressers, get our hair done. It's time to open up. The sick are being taken care of. If you're sick, stay home and in your house. The ones that can work need to work. We need to open our businesses.
I've had a quadruple bypass. I've had a heart attack, a stroke, and I'm still not afraid to go out in public. It's how you take care of yourself. We're not, like I said, we're not her children. Until this virus runs its course, it's gonna stay here. And all we're doing is hiding from it.
What if it was your mother? What if it was your father? What if your infant son or daughter gets sick because you decide to go around and open up the windows so your kids and your family members can hang their heads out the window to support something that you have no business to do?
of the fact of people flying Confederate flags on your streets to protest a stay-at-home order that's meant to save their lives?
It wasn't really about the stay-at-home order at all. It was essentially a political rally, a political statement that flies in the face of all of the science, all of the best practices, and in the stay-home order that was issued. A small group of people that came together without masks on, who were passing out candy and with bare hands to children, who were congregating together, who were, brandishing their weapons, who were having, posters of being anti-choice. The cars were blocking one of our hospitals, so an ambulance literally wasn't able to get into the bay for 10 minutes. This is the kind of behavior that extends the need for stay-home orders, that spreads COVID-19.
Don't call the woman in Michigan. Well, it doesn't make any difference what happens.
In Michigan, the governor there, Gretchen Whitmer, speaking of mediocre, is auditioning to be Joe Biden's vice president by banning citizens from traveling to their own homes.
These restrictions are ridiculous, and thousands of people came out to protest. Does it surprise you?
It surprises me that it took them this long to come out, Brian.
And as more and more states go online and get their rights back, that is going to fuel, I believe, other states to go, wait a second, this is getting ridiculous. You got 29 states without a big imprint from this virus.